If you're over 70 and your doctor just celebrated getting your blood pressure down to 120 over 80, you need to hear this before your next appointment. A study published in the Journal of the American Medical Association tracked more than 15,000 seniors over 5 years. And what they found goes against nearly everything we've been told about blood pressure targets. The seniors with so called perfect blood pressure had a 28% higher risk of serious falls. Their mortality rates were actually worse than seniors with moderately higher numbers. In the next few minutes, I'm going to walk you through the exact blood pressure range linked to the longest survival in older adults, why the standard target can become dangerous after 75, and one simple test you can do at home tonight that could prevent a devastating fall. I'm Dr. Simon Ashford, and this information could genuinely change or save your life. Before we go further, drop a comment right now with just your age. Nothing else, just your age. I want to see who's watching because what I'm about to share applies very differently depending on whether you're 65, 75, or 85. And if you've ever felt dizzy standing up from a chair or getting out of bed, add the word dizzy to your comment. You'll understand exactly why that matters in just a few minutes. Here's a scene playing out in doctors' offices across the country right now, every single day. A 78-year-old comes in for a routine checkup. Blood pressure reads 145 over 86. The doctor pulls up the standard guidelines, sees the target of less than 130 systolic, and reaches for the prescription pad. One medication gets added, then another. 6 months later, the blood pressure has come down beautifully, 124 over 78. The doctor is pleased. The patient gets a gold star. Everyone walks away thinking this is a success story. But here's what the guidelines don't account for. That same 78-year-old gets up to use the bathroom in the middle of the night. Their blood pressure drops from 124 over 78 down to 88 over 56 within seconds. The brain isn't getting enough blood flow. The room spins. They reach for the wall and miss. Now we're not talking about blood pressure numbers anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in rehab, and a cascade of complications that far too often ends in loss of independence, or worse. Research published recently in JAMA Internal Medicine should have made headlines everywhere. Most doctors still haven't fully processed it. Most patients have never heard about it. And that gap between what the research shows and what's actually happening in everyday medical practice is costing lives. Here's the part that's going to sound counterintuitive. Stay with me, because this is where everything shifts. For decades, the message has been simple. Lower blood pressure equals better health. And for people in their 40s and 50s, that's largely true. Getting blood pressure under control in midlife genuinely prevents heart attacks, strokes, and kidney disease. The evidence there is solid, but something fundamental changes after 75. Research shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. The group that achieved that textbook perfect 120 over 80, they had higher rates of dizziness, syncope, that's the medical term for fainting, acute kidney injury, and yes, higher mortality. Very low pressure turned out to be just as dangerous as very high pressure. To understand why, you need to understand three things that change as we age, and why those changes demand different blood pressure targets. First, arterial stiffness. As you get older, your arteries lose their elasticity. Think of a brand new garden hose versus one that's been sitting outside in the sun for 20 years. The old one is stiff, less flexible. Your arteries go through a similar process. When your heart pumps blood into stiff arteries, they can't expand and absorb the pressure wave the way young, flexible arteries do. So you actually need a slightly higher baseline pressure to ensure adequate blood flow reaches your brain and kidneys, especially when you're standing upright and blood has to travel against gravity. Second, baroreceptor function declines. Baroreceptors are tiny sensors in your blood vessels. They detect pressure changes and instantly signal your brain to compensate. When a younger person stands up, those sensors respond within milliseconds. Heart rate adjusts, blood vessels tighten, pressure stabilizes. But with age, those sensors slow down. they respond later. So if your baseline pressure is already low and your baroreceptors are sluggish, you get that dangerous drop in pressure when you stand, orthostatic hypotension. It's not just dizziness, it's a fall waiting to happen. Third, medication metabolism changes. Your kidneys and liver don't clear medications as efficiently at 75 as they did at 45. A dose that's perfectly calibrated for a middle aged patient can be excessive for an older adult. The medication stays in your system longer, works harder, and can push your blood pressure far lower than intended. Now, let me tell you exactly what the research found, because the specifics matter. The study followed 15,342 adults over 75 for an average of 5 years. These weren't cherry picked, perfectly healthy seniors. These were real world older adults, people with diabetes, prior strokes, heart disease, varying levels of frailty. Researchers tracked their average blood pressure and monitored outcomes over those 5 years. The results were striking. The lowest mortality rate was in the group with systolic pressure between 130 and 140, not below 120, the moderate range. Those with pressure below 120 had a 28% increased risk of serious falls requiring hospitalization, higher rates of acute kidney injury, and overall mortality rates 14% higher than those in the 130 to 140 group. The sweet spot, the range linked to the longest survival and best quality of life, was higher than what conventional guidelines recommend. Let me paint you a picture of how this plays out in real life. You're 76. You go in for a routine checkup. Blood pressure reads 142 over 84. Your doctor looks concerned, cites the guidelines, and says you need to get this down to at least 130, ideally closer to 120. A medication is started. 2 months later, you're at 128 over 78. Your doctor is happy, suggests adding a second medication. 2 more months pass. You're at 122 over 76. Perfect. At first, you feel fine. But then you start noticing something. When you stand up to answer the phone, you feel momentarily lightheaded. When you push back from the dinner table, the room tilts for just a second. You mention it to your doctor. They say it's probably just age, just stand up more slowly. But what's actually happening is this. Your blood pressure, which looks great sitting still in the office, is dropping dramatically when you stand. From 122 over 76 sitting, down to perhaps 95 over 60 on your feet. Your brain is experiencing repeated episodes of inadequate blood flow. You're at serious risk for a fall, but nobody's checking for this because your sitting blood pressure looks textbook perfect. This happens thousands of times a day across the country, and it's preventable. There's a simple 3-minute test that can tell you whether your blood pressure medications are putting you at risk for falls. It's called orthostatic vital sign measurement. Most doctors aren't doing it routinely. So let me teach you how to do it at home tonight. You'll need a home blood pressure monitor, available at any pharmacy for around $30. Here's the protocol. Lie down flat on your bed or couch for 5 minutes. Just rest. After 5 minutes, check your blood pressure while still lying down. Write down both numbers, then stand up and check your blood pressure again immediately. Don't wait. Write those numbers down too. Now compare them. If your systolic dropped by more than 20 points or your diastolic dropped by more than 10 points, you have orthostatic hypotension. That's a red flag. It means your medications may be too strong or your blood pressure target may be too low for your body. Let me give you a concrete example. Your lying pressure is 125 over 78. Looks great on paper, but standing, it drops to 98 over 64. That's a 27-point systolic drop. Your brain isn't getting adequate blood flow when you're upright, which is most of your waking hours. You might feel fine in the chair or the bed, but the moment you're on your feet, you're running on insufficient pressure. If your doctor isn't doing this test at every visit and you're over 70 on blood pressure medication, do it yourself and bring the results to your next appointment. So, what should your blood pressure actually be? Here are the ranges that research links to the best outcomes by age group. But understand, these are guidelines, not absolute rules. Your individual target should always be worked out with your doctor based on your full medical picture. For adults age 65 to 74 who are generally healthy and active, Research suggests a systolic range of 130 to 140 is reasonable. It provides cardiovascular protection while keeping organ blood flow adequate. For adults aged 75 to 84 who are relatively healthy, the evidence supports a systolic range of 135 to 145. That's intentionally higher than the younger group because arterial stiffness and slower baroreceptor responses are real factors at this age. For adults over 85 or those who are frail at any age, a systolic range of 140 to 150 may actually be most appropriate. At this stage, preventing falls and maintaining quality of life often carries more weight than aggressive blood pressure lowering. On the diastolic side, that bottom number, for older adults, it should generally stay above 65, ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle during its resting phase. If yours is consistently below 60, that's worth bringing up with your doctor, even if the top number looks fine. Now, why hasn't your doctor mentioned any of this? The answer is a bit complicated, but it comes down to how slowly medical practice changes. Most blood pressure guidelines were built on large clinical trials conducted primarily in middle-aged adults. When those results came out, the guidelines were applied broadly across all ages. There was an assumption that what works for a 50-year-old must also work for an 80-year-old. Over the past decade, researchers have started looking specifically at older populations, and the findings are different, but it takes years for new research to shift clinical guidelines, and even longer for those guidelines to change what actually happens in the exam room. Many doctors are still working from frameworks published 5 or 10 years ago. There's also a psychological piece. For decades, doctors have been trained that lowering blood pressure saves lives. That message runs deep. Shifting to a more nuanced view, one that says sometimes moderate elevation is actually safer, requires a different way of thinking about each patient as an individual rather than applying a universal target. And in a healthcare system where appointments run 15 minutes, that kind of individualized thinking is genuinely hard to do. Let me show you how differently two people the same age can look. Both are 81. Both have a blood pressure reading of 158/88. Same number, same age, completely different situations. The first person has mild heart failure, stage 3 chronic kidney disease, and osteoarthritis. The second is healthy, active, plays golf twice a week, no significant medical conditions. For the first person, aggressive treatment carries real risk. Multiple blood pressure medications could drop pressure too low when standing, worsen kidney function, cause dizziness, and dramatically increase fall risk, which with osteoarthritis could be catastrophic. A more sensible approach might be lifestyle changes first, then if medication is needed, a low dose of a single drug with careful monitoring. Accepting a target of 140 to 145 systolic rather than pushing hard toward 130. For the second person, the healthy, active 81-year-old, lifestyle changes might bring pressure down to 145/84 on their own, which for someone in that condition could be entirely acceptable without any medication at all. Same numbers, different people, different approaches. This is what it means to treat the patient rather than the number. Here are specific steps you can take starting tonight. If you're over 70 and on blood pressure medications, get a home blood pressure monitor if you don't have one. Check your pressure at the same time each morning and evening for 2 weeks. Keep a written log. This gives you a true average and shows patterns that a single office reading never could. Do the orthostatic test. Lying down for 5 minutes, check your pressure, stand up, check again immediately. A drop of more than 20 points systolic or 10 points diastolic is worth documenting and discussing. Be honest with yourself about symptoms. Dizziness when standing, unexplained fatigue, difficulty concentrating. These can all be signs that blood pressure has been pushed too low even when the numbers in the office look fine. Schedule a conversation with your doctor specifically about your blood pressure target, not a passing comment at the end of an appointment, an actual conversation. Ask what target makes sense given your age, your conditions, your daily function. Bring your home log, bring your orthostatic measurements. Come prepared. And if you're experiencing side effects from your medications, say so. Don't just accept dizziness or exhaustion as the price of treatment. Doses can be adjusted, medications can be changed, targets can be modified. You have more options than you might realize. Here's what you now understand that most people, including many healthcare providers, don't fully appreciate. Blood pressure targets should not be one size fits all. A 45-year-old and an 85-year-old should not be held to the same standard. For adults over 75, systolic pressure in the range of 130 to 145 is associated with the longest survival and the best quality of life. Below 120 increases the risk of falls, orthostatic hypotension, kidney injury, and possibly cognitive decline. Above 150 raises cardiovascular risk. The optimal range sits in the middle, and it's higher than most people have been told. You now know how to test for orthostatic hypotension at home. You understand the physiology, arterial stiffness, slower baroreceptor response, changed medication metabolism that makes older adults genuinely different from younger ones when it comes to blood pressure management. Most importantly, you have the language and the understanding to walk into your doctor's office and have an informed conversation. You're not a passive recipient of medical decisions. You're a participant in your own care. Drop a comment saying informed if this gave you more confidence to have that conversation. Share this with anyone over 65 in your life who might need to hear it. In my next video, I'll cover 3 supplements that research actually supports for healthy blood pressure management and 2 popular ones that are a complete waste of money. You'll want to see that because the supplement space is full of misleading claims, and I'm going to show you exactly what the evidence says. I'll see you there. This video is for educational and informational purposes only and is not intended as medical advice. Blood pressure management should be individualized based on your complete medical history and health status. Never adjust or stop medications without consulting your healthcare provider. Always work with a qualified medical professional before making changes to your treatment plan.